Well, here's something you don't hear too often. A leading group of pediatricians say more children should be getting surgery.
That's what the American Academy of Pediatrics says when it comes to solutions for obese children. KCTV5's Betsy Webster talked to one doctor who's leading the way locally.
1, 2, 3,
These kids at Lenex's Pinnacle Gymnastics are staying active. And when we told their parents about obese kids getting surgery to lose weight, some said, no way.
Personally, in my own opinion, I wouldn't agree with it because they're still developing at that age.
Others said, it depends.
It's ultimately whatever's going to be the best for the child is what we all want as parents.
A lot of people think that eating better and exercising more should be enough, but the position paper published just 24 hours ago says otherwise. And experts say, sure, some kids just need to grow into their bodies, but we're talking about kids who are severely obese.
Once you get to a certain weight, it's really hard to make those big global changes within your body from a lifestyle modification perspective, but also from a neurohormonal kind of perspective as well.
Children's Mercy Hospital has a program geared specifically to pediatric weight loss. This 11-year-old we profiled 2 years ago had success with diet and exercise. Here's his before and after, just a few months apart. But now Children's Mercy also has a bariatric surgery program for kids, headed by Dr. Jason Frazier, who has done about 25 such surgeries so far, mostly on teens, but one on a preteen.
It's relatively rare in the city as well as in the region to have a center that does bariatric surgery in adolescents.
The American Academy of Pediatrics recommendation is for those who are severely obese. The group says that primary care docs aren't referring enough and insurance isn't covering enough. The paper cites low complication rates for its recommendation and even says sooner can be better. Quote, outcomes are improved and complication rates are lower when surgery is done sooner.
The sooner that these operations happen, the better, because as you put on more weight, you start having more comorbidities and more problems, diabetes, high blood pressure, sleep apnea, those things continue to mount up. And the more problems you have going into an operation, the more difficult it is for you to recover.
Just like with adults, though, there needs to be lifestyle change along with that surgery, or you're back to square one. That's why the Children's Mercy program is a long-term program involving more than just doctors and surgeons, but also people like psychologists and nutritionists. Betsy Webster, KCTV5 News.